You are listening to Inspired Caring with Michelle Magner, episode number 126. Hello, welcome to Inspired Caring. I'm your host, Michelle Magner. If you are caring for an older family member, this is the podcast for you. Each week, I bring insight, tips, inspiration, and strategies to help you care for the people that you love without losing yourself along the way. Having cared for both of my grandmothers, I've helped manage everything from hospital stays, households full of belongings, to navigating senior living and end-of-life care. And I've worked in senior living as a result of that experience, serving my residents and their families as they've been on this journey too. Thank you for joining me today, and I hope you enjoy this episode of Inspired Caring. I'm welcoming Dr. Logan DuBose.
You got it.
Okay, got it. Who graciously said I can call him Logan so I don't stumble over his last name through our time together. And you have a fascinating background and you are working on some really important projects. So I'm really excited to have you here today to share this stuff with us.
Likewise, and I told you earlier, I'll say it again, your work working with caregivers and on the podcast, bringing awareness to what sometimes is very underlooked, resources lacking in senior care and needing guidance. Your work in this field, bringing awareness to that, bringing me here today to talk about it is much appreciated. Thank you for having me.
Well, wonderful. I'm so glad you're here. So you are earned your medical degree and an MBA simultaneously or within range of each other through Texas
Yes, ma'am.
A&M.
That's right. I think Texas A&M gave me the opportunity to add a different flavor to my medical degree, and that was through this MBA program, which I worked with teams and we focused a bit on healthcare administration, on high impact projects. They can affect the vulnerable populations, and leadership and business experience and formal training definitely complements well the complexities of the medical system. When you think about high impact projects, how can we make a difference on an organizational level? And so that's what led me to pursue the MBA as well.
Well, and I think about our current medical system and really long-term care and how we're aging and how we're caring for our elderly, and all of it feels super unsustainable.
Oh boy.
Yeah.
Yeah, I could talk a bit about it. Yeah, I could quote some statistics I was just reading about. I think one, when we think about unsustainability, we can think about it from a cost perspective,
Mhm.
um, which are very high. You know, you can think about, for example, one of the most demanding conditions, dementia, Alzheimer's, and caregiving for somebody with dementia and Alzheimer's can lead to high out-of-pocket expenses. That's very unsustainable. For example, memory care can cost over $100,000 a year.
Mhm.
And with almost 7 out of 10 of us eventually needing some form of long-term care, maybe a nursing home at $100,000 a year, with 1 out of 3 of Americans economically insecure, how is that sustainable? It's not sustainable at all. So how are people affording these services that most of us will sometimes need? Well, oftentimes they're not. And what happens is needs go unmet. And unfortunately, people will end up in the hospital where I'll meet them for the first time. And that's
Mhm.
quite unfortunate. So the costs are very unsustainable. But we could get into some other things too, but I'll stop there.
Yeah, no, and I think just within my own family, mother-in-law diagnosed with dementia in 2016. Father-in-law was her primary caregiver. He was able to keep her home for a pretty good chunk of time, about 6 months before it became clear it was time for her to move to memory care. He was diagnosed with advanced renal cancer that had already just spread everywhere. So ultimately, he passed away first,
Mm,
which is not uncommon.
mm,
She had 3 years in memory care where he was part of that for quite a while, but he passed away and then she passed away. So I think this is part of the unsustainability that I think about when how we're aging and what systems are in place. Like we really have to take better care of ourselves because financially it's unsustainable, and just for our own aging process, like it can be
Yes.
pretty dangerous.
It's when I show up at the hospital each morning, and a lot of people might not have this perspective, so I feel like it's important to share. Maybe 25% to 50% of the patients that I see that day are there due to, unfortunately, a vicious cycle of neglect that occurs. And and when I say neglect, I say maybe just a lack of support in the long-term care infrastructure that's occurring outside of the hospital. For example, wound infections not being taken care of and leading to sepsis, um, urinary tract infections leading to altered mental status due to incontinence being difficult to manage at home. That's a big,
Mhm.
big one. Diabetes going uncontrolled, so sugar levels going uncontrolled, people coming into the hospital for that. Um, Failure to thrive due to lack of nutrition, and difficulties with eating. Um, and then often there's families that just simply are not able to take care of an elderly individual and will bring them to the ER in a fashion like that for social services to try and help find a way to match them with some sort of care, either a nursing home or assisted living facility, but likely a nursing home at that point. So you see these 4 to 5 out of 10 of my patients a day here at the hospital due to a failure of the long-term care system on the outside supplying the care that they needed to meet their basic needs. And so the hospital and the healthcare system ends up taking care of that. And that's
Right.
that's that's unsustainable. That's unsustainable. And we could talk about that for a long time, but that's unsustainable.
Right. And when you say long-term care system, coming from a
Mm,
senior living world, we're not necessarily talking about senior living housing of long-term care. It sounds like literally living with chronic illness and disease for the last 12 years of our life, which seems statistically where we're at right now. That long-term care of taking care of yourself at home, potentially,
hmm
um, that these last decades are just not going well for us, which is part of that.
well, I mentioned the costs of um, facility-based care. You would think of a
Right.
nursing home and memory care, and all of this jargon actually gets very confusing. You and I are in this field, but for others listening, you might not know. But facility-based nursing home care, assisted living, these are senior living communities,
Mhm.
or facilities that often cost a lot. But as you mentioned, home care is what most people prefer to do, what most people would
Right.
like to be at home. And actually, most people need quality home care to avoid going to the hospital. Um, but that's also expensive. Mostly private pay for the most part, unless you qualify for federal, state, or local programs and aid, which can be difficult to access and understand without help. But the costs are almost 50 to $60,000 a year for, not necessarily 24/7 care, but close to, which a lot of people will need. So, I think it's about $30, $40 an hour for most caregiving agencies to send a caregiver to the home for basic needs like showering or bathing or light housekeeping and such. So these costs, for most Americans, are pretty devastating, to be absolutely
Mhm.
honest, and pretty cumbersome. And 40% of family caregivers, you might know, this is what I believe it was, either AARP or Alzheimer's Association, but 40% of family caregivers will often have to quit their jobs because these expenses are too high to hire others for help where they maintain their job. And so a lot of these costs are also in labor costs of the caregiver, um, or opportunity costs of not being able to work due to responsibilities at home.
Right. Which sends that family caregiver or care partner, whatever your terminology is that
Hmm.
people prefer who are listening, it sends your own health trajectory in a negative spiral because now you have left your place of employment. You are probably a little more isolated. and
Mhm.
really the lacking in resources. And I'm excited for what you have created and the backing that you have for this company that you have created, because people who are in this role,
Mhm.
and let's be frank, it is a spouse, a daughter, a
Mhm.
granddaughter, a niece, right? A neighbor. Like, this is the title that we really are in,
Yep.
but we are referring to people as family caregivers. And once you find yourself on this path, finding resources to help you can be pretty tough. So I would love to hear
Yeah.
more about your company.
Yeah.
It's
Yeah.
Alera.
That's correct. Valera. Absolutely. I'd love to talk about Olera, but before I do that, I'll talk about what kind of inspired Olera
I
and
would
our
love that.
mission. Our mission, I guess I'll start there, is resource connection, is trying to address that problem that I mentioned at the hospital, that most of the patients are from a vicious cycle of a lack of support outside of the hospital. That's what my primary intention is, to create some form of a support structure for when a patient leaves the hospital and they're a geriatric patient or an elderly patient, or even a patient with severe disabilities. They have a resource, an ongoing support system in order to connect to resources. So that's what I found in the hospital so frustrating, is patients leaving the hospital but then coming back the next
Mhm.
day because they did not have lack, or the next week because they had lack of support on the out. So that is what the pure motivation is coming from there. So now how we're approaching that in this phase of our development of the company, we created this website, and it's a personalized web based care planning tool. So it's a care planning tool that you can use, and what it does is you answer questions about your situation and your needs, be it activities of daily living assistance such as bathing, cooking, cleaning for a loved one, for yourself even. Where are you located? What are your
Mhm.
preferences, for example? Do you prefer home care? Are you looking directly for an assisted living? Some of these questions and this jargon, it really takes a focused assessment to understand your needs. And we're trying to capture what we can do well online to try and spread some of these assessments that are done often in person in the hospital by social workers or physicians. I'm trying to find out what is it that you need. And then the next step is to, after we've identified what can help you preserve the quality of life at home, meet your basic needs, stay out of the hospital, how do we connect you with those things? And so now we're mapping what we call the elder care ecosystem.
Mm.
Elder care ecosystem is a vast, complex system. Maybe we pause there. I saw you smile. The elder care
Yeah, I'm
ecosystem.
like,
What does that term mean to you? I'm curious.
yeah.
Mhm.
Uh, so what that would mean to me is what I have used that term in reference to when you're working on a team and someone on your team decides to quit, like, or a good friend in your neighborhood decides to move out of the neighborhood, like your ecosystem, your bubble of normalcy and what you're used to and the support and people that you've
Mhm.
had in your world are in place has now been disrupted. So I love, I mean, I don't know if that's trademarked, but you should do it. But I love that concept.
Well, yeah, and we actually recently published a bit on it. I'll definitely send you over our recent thematic analysis of caregiver challenges. So that's fancy academic jargon for, we talk to family caregivers and we ask them, what is the ecosystem that you live in? And by ecosystem, what I mean is, what are all of the people, medical goods, products, services? What do you interact with throughout the caregiver journey, which is a long journey with many different interactions with professionals, informal advisors such as families, friends, churches, um, all sorts of different interactions that occur. And so we talk to family caregivers and we ask them, what are those touch points with different assistants that you need, be it a friend, be it a assisted living home, be it a home care agency, a Meals on Wheels service, all of these different services. What are those? And so what we're interested in now is taking that ecosystem and organizing it a little bit better. and delivering it a little bit more streamlined so that people can better access and understand not just what they might need right now, but what the future journey, what the future interactions with different help might be. And most importantly, how much is this going to cost and how am I going to access it? That's what
Yeah,
I'm most interested in helping people understand better.
that's amazing. And the isolation and loneliness that comes from being on this caregiver journey, we know there are statistics around that. I think it's like equivalent of 6 alcoholic beverages a day or 15 cigarettes a day. And so it feels like having really pinpoint for someone this elder care ecosystem, it keeps it on their radar that they cannot do this alone.
Absolutely. Absolutely. You have to have a care team. And what I mean by a care team is it's again this well, as you're going through your elder care ecosystem and needs arise and new behaviors happen, agitation, for example, that once wasn't there, or sleeping behaviors that weren't once there, or wandering, for example, that wasn't once there. Arthritis, they can't move, can't go to the bathroom, shower on their own. Who are you going to call?
Mm,
Who's in your phone book? Who's in your Rolodex? Right.
mm.
And that's what we're interested in, filling that up with a rich, easy to access Rolodex at first in this first phase. And I'll talk a little bit more about kind of these phases I keep mentioning. But that's where we're focused. We want to build out the Rolodex. We want to build out that directory, that yellow pages, you might think, that Yelp that's accurate, up to date, vetted, high quality information, caregiver centric, with caregivers helping design and giving feedback on is this useful or not. That's what we're interested in doing with the company, and that's where we're at right now. Um, yeah.
Yeah. So do you think it's appropriate to talk about like the group that is helping fund the research and the product, or do you think it's better to
Yeah.
go into the phases?
No, let's talk a little bit about both. We can start with the National Institute on Aging, and I'll mention that this company is right now at its roots a research company. So we
Mhm.
provide research and development of products for the National Institute on Aging in these phases that I'm mentioning. So we propose a web-based personalized care planning tool for family caregivers to the National Institute on Aging to help with caregiver burden, which is a combination of the financial, psychological, um, and functional and physical
Mm.
burdens that sometimes come with caring for somebody with disabilities or somebody with dementia, particularly. So the National Institute on Aging was very interested in our ideas on how not only what we would build, but how we would build it. And that's where the research part comes in. So I mentioned a thematic analysis of caregiving challenges. The first research was, what are people challenged with? Let's get an updated 2020, 2023 snapshot on what people are challenged with and what services they're using. And so we published that, and that went direct. Then let's ask people, what do they want out of a care planning tool before we just start building? And so we did that as well. And we'll soon publish what people were looking for and how they responded to our first crack at making this care planning tool, which was about almost a year ago now. So now we're into this phase two, and we've taken more feedback, and we're relaunching a new iteration of the website in Houston, Texas. That's where we're going to start. We're going to
Mhm.
spread from there. And we've mapped the elder care ecosystem as much as we know it in Houston. And families can log on to our website, olera.care, and I'm happy to share the link,
Mhm.
answer a questionnaire, and they can connect with myself at times, or other staff members who are manning our hotline, and they can just tell us what they need. If they are overwhelmed with a behavior, if they're looking for a service they already know they need, if they just want to talk, we're available to kind of field and assess those needs and see if there's anything in our elder care ecosystem in Houston that this time that can help them. And then we're going to be working with families over time that have used our service to give us feedback and fix that service even
Mm.
better and optimize it. And that's another thing that we'll be reporting to the NIH, the National Institute of Health, who funds this project. So this whole project will be is funded by the National Institute on Aging, with the hopes that it would be able to self-fund itself eventually, once we achieve a service that not only, most importantly, helps families with what they really need, but also can fund itself and sustain itself in some sort of business. That's where the company part comes in, which I can talk about as well if you're interested.
Well, I think certainly, because I think this is the innovation that we're looking for to help fix this unsustainable system that we opened our conversation with. We cannot just continue with the same trajectory and systems in place that we have had in the past. We're just living longer.
Living longer, and we are getting sicker.
We're
Living
getting
longer, we're
sicker.
getting sicker. And we're
Yeah.
spending more. We're spending more on healthcare than ever. And we're having some of the worst results of developed countries, some of the worst results, health outcomes. It's just absolutely just striking when you think about that. And then you walk through the hospital, or you experience this yourself, or a loved one or a friend experiences an interaction with the healthcare system that maybe wasn't ideal. And you start to feel it, like, oh my goodness, like, this is unsustainable. What am I going to do if I go to the hospital, or my
Mhm.
loved one goes to the hospital? What if I needed care? Well, how am I going to pay for it? And so these anxieties are very well founded, because we don't have great answers right now. And I noticed this in the hospital as I'm training, and the social workers are pulling double time right now, trying to
Mhm.
arrange these resource connections. A lot of our interactions, a lot of a patient's needle moving actions that happen in the hospital are often from the social worker.
Mhm.
So I kind of got off on a tangent there, but I can circle it back to
I
whatever
pulled the
your main question
thread.
was. I'm sorry.
I pulled the thread because I feel very passionate about it as well, which it does. I think that was part of my practicum for my master certification in gerontology, was just like, what are some of the other aspects of aging that we're not really taking into consideration, like our home environment and who we're hanging out with and some of the emotional factors. And so I'm excited to continue to dig into that.
Totally.
But I think that
Absolutely.
this is such a great innovative space that you're in to help provide families with an actual tool that they can actually access to help them figure out what they need and take them in the right direction.
Absolutely. And I think it's clear that there's a lot of information available online. If you look online, there's a lot of information available. There's the NIH website, CDC, you have Alzheimer's Association, AARP, and everything in between, blogs. There's all sorts of information on caregiving. But how often is that taken into practical, step-by-step instructions that you're going to act on, that are helpful to you,
Right.
that then execute what you need? Often, sometimes it does happen. I mean, I'm not knocking these great websites, but it's a plethora of information that's overwhelming. And so the personalized aspect, the personalized care planning tool, is trying to build on the shoulder of giants, all of this excellent information online. How do we work with caregivers and ask them in a scientific way, is this helpful? Is this not helpful? Yes or no? What's not
Right.
helpful? How do I present this? What jargon doesn't make sense? How does the web page lay out? And where are we losing people? Where are people dropping off because it's confusing? This sort of user experience design on the caregiver front is where we're focusing our time, because we just noticed that though there's a lot of things available, when you talk to caregivers, they're still saying, I don't know where to go. I don't
Right.
know what to do. I don't know who to ask. And what are people doing? They're talking to their friends, their families, their doctors.
Mhm.
Absolutely. And that is excellent, excellent resources. However, oftentimes incomplete, and oftentimes not the effective at moving the needle and getting you the home care you need to keep you out of the hospital, for example.
Right.
Sometimes not.
Well, and you look at the CDC website on how to prevent chronic illness and disease, and everything that they list specifically are lifestyle and behavior modifications, right? Get enough sleep, don't drink alcohol, do your pre-screenings, exercise. And I just think when we're in this family caregiver role, our bandwidth is so stretched because so many
Oh
of
boy.
us are trying to work. We may still have kids at home, or maybe a care partner is also in her later or his later aging years. So just the energy requirement, it's like step one is acknowledging, okay, I need some help here, I think. And then two is looking around, what are those resources? And then how do I implement them?
You've nailed it. I mean, those are the three steps. It's what do I need? Where do I get what I need? What services or professionals can help me? How do I access and maintain that over
Hmm.
time? So those three steps, right now we're really into trying to develop it one piece at a time. How do we identify what somebody needs and then do it in a way that we can scale it through the internet, where we could hopefully mass eligibility screen many, many people, right? That's the hope. For example, I think it's 30 billion that are 30 billion in unclaimed financial aid each year for the elderly. That's for food, housing, prescriptions, healthcare. 30 billion goes unclaimed because of not knowing where to apply, how to apply, not being aware of the programs. So how can we mass eligibility screen people for things like supplemental nutrition assistance programs, supplemental social income, um, even help with Medicare, Medicaid applications, at least get people aware and started. Fill out some questions. You are eligible due to your assets being such and such, or this and this. Have you considered $1,300 a month a couple can get through SSI, supplemental social income? So these are things that when you talk to social workers or you work with social workers, you'll ask, what is the thing that you're signing people up for the most in the hospital that they've just never heard of, that they're missing out on this benefits? And they'll say SSI, disability insurance. They'll say helping people connect with ways that they can spend down their assets to qualify for Medicaid. That's a big, or get caregiving paid for by Medicaid. These are some of the most common things that people are not doing or are having trouble doing and need a little bit of guidance and professional help understanding. The internet's there, but it's hard for somebody with many degrees to figure all of this out. It almost
Right,
takes a specialty in social work, and that's why the field of social work's almost developed, if you think about it.
right. Yeah.
It's crazy. But anyways, sorry to ramble.
No, I think about my father-in-law and his VA benefits when he was diagnosed with cancer. It really wasn't on his radar to circle back to the VA just to check in and say, hey, I have renal cancer. And when we asked the oncologist what could have possibly been the source, he mentioned Agent Orange, which of
Mm,
course was used in Vietnam where he served. So that's not to say that that was the cause. I mean, there's no way to know, obviously, but he was a veteran, and so he had these VA benefits. Um, that he would have otherwise not used. I mean, he saved on property taxes, received a monthly supplemental income that helped with
exactly.
cost of treatments, things like that. So I just think this is a great product that you are creating. What's your timeline? Like, it sounds
Yeah.
like you're in it, you're waist deep.
Absolutely. Yeah. And just one more thing, because the VA benefits. So I work at the VA too during training, and the social workers there getting people service, the percent service covered that you are. Agent Orange, for example, not mentioning that to your social worker at the VA could make the difference in your service connection percentage, which makes the difference in your payment that you'll get from the government for your service, and hence sometimes people missing out on aid. And so it's connecting with somebody who knows the system. As complex as it is, it requires a professional to navigate at times VA benefits. So there's VA counselors, and a lot of times people don't know to do that.
Yeah.
So that's good. But back to your question about timeline. So we received this funding in 2021, I believe. It was right between 20, it was right after COVID, or it was right during the midst of COVID, towards the end of that, of maybe 2021-ish. And so we have phase one, which is completed now, which was, let's talk to family caregivers, figure out the biggest problems, and let's attempt to create a personalized web care tool. We did that and completed that in May of 2022. And now we're moving on, and currently we've revamped the website. We're ready for relaunching. We're doing some pilot launches in Houston right now, and we're recruiting actually 300 family caregivers of somebody with dementia, of a person living with dementia or memory loss, to use the website formally over time, about 4 weeks, and to try and connect with services, to read our education on different programs that are available to you. We'll be available for the support calls that I mentioned, and utilize our services if needed or not. The point is to see how individuals interact with the website and just give us honest feedback. Is it useful or not? Both answers are useful to us because we have a phase three in mind, where we're going to continue to iterate on the website over and over and over again, keeping it caregiver centric and mapping out the elder care ecosystem based on what caregivers need. And we've developed a research and development process we call the build, measure, learn process, the framework that we use. And we're going to continue to do that. And theoretically, if we continue, caregivers will be the ones who make this a service for them, a service that works for them. And that's the goal. And so I think timeline wise, we'll be recruiting for this study for the rest of through the spring. We would like to finish this study in May. So if anybody's interested, I'll share the link on how you can sign up and get your screening for eligibility and enroll in the study. It's simply 4 weeks. You'll use the website, 2 calls, a few surveys, very understanding how busy everyone is, very low maintenance. I think a total of 30 minutes of talking to me or one of my partners in the research group, and then interacting with the website as much as it's useful or not. So it's very low maintenance. Around May, we'd like to be done with that. And once we look at those results, we'll enter into another build phase, probably towards the summer. And we'll hopefully come out with version 3. And we have some other things that we're thinking about with artificial intelligence in this version 3 that we'd like to incorporate that will personalize our experience even more and allow us to process even more programs and services to eligibility match people. So that's really exciting too. That's looking forward into 2023 and 2024. Or sorry, 2024, 2025.
So it sounds like I just also briefly would like to encourage people to participate in the study, because this is how we create change, right? This is how we create the products that we all need to help ourselves. If we remain stuck in this, well, it just is what it is mode, this is what we have been sharing. This is what's unsustainable. So hopefully people will follow that link and engage, because that is how we're going to create the things that we need to help ourselves. And I completely forgot my other train of thought.
That's fine, because I'll also say, I forgot to mention a really cool part of it. We want to pass on the graciousness that the National Institute on Aging has done for us. $50 gift to any participant. That's going to be just a check sent to you. So just for using the website for 4 weeks and answering a few surveys and talking to us about what you liked and didn't like, we'll send you $50. So even more reason to join. And the caregiver centric design is fairly unique in terms of how websites are developed. And so this truly is an opportunity to help us help everyone. So I'd love to talk to anybody who might or might not be eligible. By the way, also, if you're not eligible, that does not mean that you cannot use the website. In fact, please do use the website. You use the same version that anybody in the study is using. The only difference is the people in the study meet certain criteria that academically we're using to report on in an academic fashion. No difference, though. If you're not in the study, the only difference is you unfortunately won't get our $50 gift, but you're welcome to please do use the resource. It's made for you as well.
Well, sure. And that is the ultimate gift, is having the resources that people need. at the time that they need them. I love that you are going to add the layer of AI in there. I just created a video series called Illuminating Senior Living. And having worked in senior living for 7 years, I felt like I was the one who toured so many families, and people had just dragged their feet and really suffered at home at the health
Mm,
expense of themselves or their family member because they were afraid of senior living. They didn't understand it, to your point, the jargon, the terminology. So I created this
mm,
course and I outline, I go through videos, every level of care, what the experts want you to know, frequently asked questions, common objections. I wrote all of these scripts. I made for my personal family caregiving experience and the building. And then I dropped them into AI, Chat GPT, and put the question in there, what is assisted living, right? And it produced a response. So I was able to backfill, and then I ran it through the lens of a social worker. I have a good friend who works in a nursing home who is a social worker. And so she read
mhm.
every single one of these scripts for accuracy. And I think that let's embrace AI. Let's not be afraid of it because there are going to be so many ways that it's going to benefit us as we step into our aging years and produce results on how we can care for people.
That is such an interesting experiment that you ran, and I would love to talk to you more about it now or later. But I agree. I think artificial intelligence, novel new, this is a jargon word, but novel new classes of artificial intelligence called large language models. This is what chat GPT type technology is fundamental. This is taking the language that we're using right now and putting a numeric code to it so that it can then be used to signal a computer in computer language, which is ones and zeros, right? So it can then interact with the computer better. And so this large language models is what I think your experiment was actually like really on the breaking edge of. How can we use these large language models like ChatGPT? How can we then feed it information like you did, make it smarter so that it can answer questions that we as humans might not have time to do, or maybe can't
Right.
process as fast and as quickly and as cheaply. Human mind is very expensive. Social workers are very overworked right now, and they're pulled to the hospital to do a lot of the work. But what if we could offload some of their screening questions, for example, some of their frequently asked questions, for example? What if we can deliver that via a system? That the second thing that I think is also potential, besides the data processing capacity with large language models, is the presentation mode. How do we present information to an
Mhm.
individual? Generative AI is now able to create pictures, videos. Natural language processing, another class of AI, is able to take language that a computer outputs and turn it into almost human-like conversation like we're having with the mannerisms. You can think of Siri and Alexa, but even more sophisticated as we continue to develop this technology. Is that potentially a better way to deliver information to a senior or to their family member? Um,
Yeah.
Research shows possibly, and we'll see, because that's something else we would like to test is the processing capacity, but also how can we use AI to effectively deliver information that's efficacious or actually useful in somebody making a positive behavioral change. That's what we're interested from a research perspective as well.
Yeah.
I'd
Well,
love to talk to you more after this call too about your
yeah.
experiment. That's really great.
I am in a group where we really have reiterated that it's not necessarily that AI is going to replace humans. It's that people who know how to use AI are going to be the ones who, I don't know, have different sets of jobs or whatever. I mean, the bottom line is in the state of Nebraska right now, we have fewer people under the age of 5 than we do over the age of 60. And so we know statistically we're getting a little upside down on having
Hmm.
human beings present
Hmm.
to care for people. So it's not a secret that our hospitals are strained, our senior living is strained. And so, how can we use these platforms and this technology, like what you're creating with Alera, to provide the information and the tools and the resources? Not necessarily to replace people, but our people are maxed out, man.
Well, we've got to. You just nailed it. couldn't have described this upward pyramid any better, with a longer living, sicker, older population with less younger people to help take care of them in an already strained healthcare and non-traditional healthcare system, which is just as important to the safety and health and well-being of the individuals as all of the non-medical home aid care centers, the companion care places, the adult daycare centers. These are all non-traditional healthcare, not necessarily in the licensed health professionals, but yet just as relevant, if not oftentimes more. How do we connect what exists right now? First off, better than
Yeah.
there's a lot out there to help people, but where we're missing the mark, and so why am I walking into the hospital to almost 50% of my patient list saying that they can't get home care, they can't get their prescriptions? Why is every other prescription that I send out of the hospital not taken by a patient? Why is that the case? We need to do better. We're running in place here. We're running in place, to be absolutely
Yeah.
honest. It's not going to last much longer. We have to use what we have better, and then continue to build more after we see what we're lacking. Very vague, very high level terms that I'm using here, but I
No,
hope
I
that makes
mean,
sense.
I am so grateful to you, doctor, because you are being proactive. You're looking for root causes. And I think this is part of what people are feeling a little bit exhausted by our medical system,
Mm.
our, our physicians who are feeling like they are just in this cogwheel. I don't even know if that's the right
Mhm.
terminology, but
No,
like,
that's a
it,
good term. Hmm.
yeah, so they feel like they're not being part of the solution, but they feel stuck on what that is. So I am so grateful to you for being innovative and reflective and taking action.
Well, I appreciate that. And to all the healthcare professionals and all the patients that interact with healthcare professionals, um, the healthcare professionals are doing the absolute best they can, and the patients are doing the absolute best they can. But we're in a system that's under resourced, um, and we're frankly in an economy that right now is very, very tough for people to afford basic care that they need. Even gas to get to the store, even a car that's insured with license plates and a registration to drive to the pharmacy, even the technical and literacy skills to call the pharmacy, to find the number online and call the pharmacy. Something's getting lost. And this is why I'll circle back, all day and talk about social workers and case managers and geriatric care professionals and family caregivers and anybody who I call when I'm at the hospital with a very sick person and say, can I safely discharge this person and know that they're not going to come back sicker and worse, or they're worse yet, are they going to meet a tragic fate as soon as they walk out of the door? Can you help them get their prescriptions? Can you help them get their home care? Can you help them get their wound care? These are the people these are the services, these are the professionals that we need to augment with technology so that we can use what we have more, use what we have better, right? And then we need to hire more and train more.
Yes.
And that's
Yeah.
something else we need to do.
Well, and yeah, I recently put something on LinkedIn about how are we incentivizing people to want to do these jobs? They are so rewarding. There is
Yes.
so much value to them. We want to make sure that they are sustainable for people so they can provide a living for their family. And how do we share the joy of helping that patient, that family member? I have so much respect. For medical professionals. I have a lot of friends who are nurses and doctors and frontline team members in senior living. And I just want to see this flourish. I think there's opportunity here. We have been very stuck in this very negative narrative for a long time. How do we show the bright side
Yeah.
and
Yeah.
the rewarding piece of it so that we can encourage people to want these jobs?
I so much appreciate you bringing that up, because I almost just realized that most of our conversation is all about the bad things, right? And that's very easy to fall into in my writing, in my speaking, in my work. I often find myself always focusing on the bad things about the aging infrastructure that we have now, the experience people have. But there's so much good. There's so much reward in taking care of somebody with disabilities, taking care of someone with special needs, taking care of somebody at the end of life in a hospice or palliative situation. It's quite possibly one of the most rewarding things that you can do is be a family caregiver, be a friend, be a physician, be a nurse, be a social worker, be a patient care tech, be a custodian, whatever it is involve yourself in the care of somebody who cannot care for themselves. How much more rewarding is that? If for all of history we have taken care of our elders, and that's been a rewarding piece, and many cultures getting older is revered. Where have we lost that? What has happened? Why the family unit is not what it once was in independent America, where people live states away and don't know their ancestry as well as they once did. We're missing that support that's always been there as a group, as a human species. It's always been
Ah,
there of taking care of the elders and the sick. We do a good job, but we could do better. We can do better, and we can change the way we think about a positive aging experience, a healthy aging community. We have a Facebook page. You're welcome to join. It's all about positive aging. Great pictures, great statements, great quotes, all about not even talking about resource connections, all about positive aging. I'd really encourage you to join it. I think we're at about 10,000 followers now, and we're posting regularly. And people just love to see that spin, that healthy, positive spin. And I think that's the answer to your question. I think that's how we get more people into gerontology, how we get
yeah.
more people into practicing geriatrics, practicing primary care for the elderly, is we talk about how this is one of the most important things to do. This is one of the biggest problems that we're facing is possibly the collapse of the long-term care infrastructure due to lack of being able to meet basic needs of the elderly. This is a big problem. It costs $344 billion a year just for dementia alone each year. Imagine with disabilities on top of that, how much money we're spending that could be saved. This is a big problem. So I think that's how we motivate people. That's how I'm motivated, is I feel like we are working together here on this call on one of the most important things that we could be doing with our time.
Well, and I think for me, it doesn't wake me up at night as much anymore because I feel like I'm in action to try and do something about it. But it's when I wake up in the morning, I am motivated, hit the ground running, thinking about the families that are suffering
Yeah.
unnecessarily, because they feel isolated and like the resources are not available. And I think that's exactly the problem that you're solving with the website. And I'm excited for people to check out Olera and connect with you through the Facebook page and get involved in the study. Let's be part of the solution. Like, let's all work together to be part of the solution. And we will shift it. We're going to change the trajectory of how we're doing this.
Thank you again for having me. This has been such a great conversation. I really appreciate your passion, and that shared motivation. When we get up in the morning, we're trying to address one of the biggest problems that exists, which is supporting some of the most important people to us, the people who took care of us when we couldn't take care of ourselves, our parents, our spouses, ourselves. This is
Mhm.
going to happen to us. So we need to pay a lot of attention, more than we are right now, because when you walk through the hospital, it's very clear that we're not paying as best attention as we could to keeping people safe and healthy at home throughout
Yeah.
all life. So thank you again. This has been a great conversation. Thank you.
Thank you so much.